Antiamebic agents. Amebiasis, also called as amebic dysentery, and it is an infection of intestinal tract caused by the Entamoeba histolytica. The disease can be acute or chronic, with the patient showing varying degrees of illness from no symptoms to mild diarrhea to dysentery. Means in the amebiasis, the patients are categorized into two types, that is symptomatic and the asymptomatic. The diagnosis can be done by isolating Entamoeba histolytica from the fresh feces. Therapy is aimed not only at the acutely ill patients but also at those who are asymptomatic carriers, because dormant Entamoeba histolytica may cause future infections in the carrier and be a potential source of infections for others. Protozoal infections are the common among the people in underdeveloped tropical and subtropical countries where the sanitary conditions, hygienic practices and control of vectors of transmission are inadequate. Life cycle of Entamoeba histolytica. Entamoeba histolytica exists in the two forms, that is cyst form and trophozoite form. Cyst form means that can survive outside the body, whereas trophozoite form means that cannot survive outside the body. This is the detailed life cycle of Entamoeba histolytica, and it consists of the steps like insertion of cyst, formation of trophozoites, penetration and multiplication of trophozoites, systemic invasion, and last step in which cyst is discarded from the body. So first step, ingestion of cyst, where the cysts are ingested through the feces and contaminated food or water. Second step is formation of trophozoite. Once the cysts are entered into the body, the cysts are passed into the lumen of the intestine where the trophozoites are liberated. In the third step, that is penetration and multiplication of the trophozoites, trophozoites are penetrated in the intestinal wall and multiply within the colon wall. They either invade and ulcerate the mucosa of large intestine or simply feeds on the intestinal bacteria. In the fourth step, the large number of trophozoites within the colon wall can also lead to the systemic invasion and cause the liver abscess, means pus is formed in the liver, and in the last step the trophozoites within the intestine are slowly carried toward the rectum where they return to the cyst form and are excreted in the feces. Classification of antiamebic agents. The antiamebic drugs are classified according to the site where the drugs are effective. They are classified into three types: luminal amebicides, systemic amebicides and mixed amebicides. Luminal amebicides means these are the amebicides which act on the parasite in the lumen of the bowel. For example, Iodoquinol, Paromomycin and Diloxanide Furoate. Second class is systemic amebicides, means these are the amebicides which act against the amoebas in the intestinal wall and liver. For example, Chloroquine, Emetine and Dehydroemetine. And the last class, mixed amebicides, means these are the amebicides which act against both the form, that is luminal, and the systemic form of the diseases. For example, Metronidazole and Tinidazole. This is the chemical classification of antiamebic agents. Antiamebic agents are also classified based upon the nature of chemical moiety present in their structures. So according to the nature of chemical moieties present in their structure, they are classified into 6 different classes. First class is nitroimidazole derivatives, for example metronidazole and tinidazole. Second class, dichloroacetamides, for example diloxanide furoate. Third class, emetines, for example emetine and dehydroemetine. Fourth class, halogenated 8-hydroxyquinolines, for example iodoquinol. Fifth class, 4-aminoquinoline derivatives, for example chloroquine. And last class antibiotics, for example paromomycin and tetracycline. Luminal amebicides, example Iodoquinol, Paromomycin and Diloxanide Furoate. They have the direct amebicidal effect to the trophozoites and the cyst forms, and they are used in the asymptomatic cyst carriers and in the intestinal amebiasis. Amebi feed on the intestinal flora, so tetracycline is added to luminal amebicides to decrease the major food source of the parasite Entamoeba histolytica. First drug from luminal amebicide is the iodoquinol. Iodoquinol belongs to the halogenated 8-hydroxyquinoline derivative, and it is an amebicide used against Entamoeba histolytica, and it is active against both the form, that is cyst, and trophozoite forms. They are localized in the lumen of the intestine, and it is considered as a drug of choice for the treatment of asymptomatic or moderate forms of amebiasis. Next drug is paromomycin. This paromomycin belongs to the class aminoglycoside antibiotic, and it is used to treat the intestinal infections such as cryptosporidiosis. Cryptosporidiosis means it is the diarrheal disease caused by the microscopic parasite Cryptosporidium. It is also used in the treatment of amebiasis and the other diseases like leishmaniasis. The route of administration for the paromomycin is the intramuscular injection as well as capsule. Paromomycin topical cream with or without gentamicin is an effective treatment for the ulcerative cutaneous leishmaniasis. The direct amebicidal action of the paromomycin means it causes the leakage by its action on the cell membrane of the parasite, and the indirect killing of bacterial flora is essential for proliferation of pathogenic amoebae. Diloxanide furoate, its chemical class is dichloroacetamide derivative. It is a luminal amebicide, meaning that it only works on infection within the intestines. Diloxanide is considered as the second line drug, while paromomycin is considered as the first line drug for the infection with amoebas when no symptoms are present but the person is passing the cyst. For the people who are the symptomatic, it is used after the treatment with amebicides that can penetrate the tissues like metronidazole or tinidazole. Mechanism of diloxanide furoate. Diloxanide furoate destroys the trophozoites of Entamoeba histolytica and prevents the amebic cyst formation. The exact mechanism of diloxanide is unknown, but it is structurally related to chloramphenicol and may act in a similar fashion by blocking the protein synthesis. The prodrug diloxanide furoate is metabolized in the gastrointestinal tract to release the active drug diloxanide. Second class systemic amebicides, for example chloroquine, emetine and dehydroemetine. These drugs are useful in treating the liver abscess or intestinal wall infections caused by the amoebas. They inhibit the protein synthesis. Chloroquine, basically it is antimalarial agent. It belongs to the class 4-aminoquinolines and is used in the combination with metronidazole and diloxanide furoate to treat and prevent amebic liver abscess. Chloroquine probably acts by concentrating in parasitic food vacuoles and preventing the polymerization of the hemoglobin breakdown product, that is heme, into the hemozoin, and thus leads to parasite toxicity due to the building up of free heme. Emetine and dehydroemetine. Emetine is the natural alkaloid which is obtained from the plant, that is Syphilis ipecacuana, and the dehydroemetine is the synthetic analog of the emetine. These act on the tissue trophozoites and they are not having any effect on the cyst, generally act by inhibiting the protein synthesis in the amoebas. Intramuscular injection is the preferred route, and emetine is concentrated in the liver where it persists for a month after the single dose. Mixed amebicides, for example metronidazole and tinidazole. Metronidazole, it belongs to the class nitroimidazole, and it is a drug of choice for amebic infection and for the infections caused by the Giardia lamblia and Trichomonas species. It kills the trophozoites and less effective against the cyst form of Entamoeba histolytica. Basically, this metronidazole is a prodrug and it requires the reductive activation of nitro group by susceptible organism. It is selectively toxic for anaerobic and microaerophilic pathogens such as Entamoeba histolytica. This organism contain the electron transport components such as the ferredoxin, and this ferredoxin have the ability to donate the electrons to metronidazole. The nitro group of metronidazole accept the electron from ferredoxin, and then metronidazole becomes reduced cytotoxic compound that binds to the proteins and DNA and resulting in the cell death of Entamoeba histolytica. Adverse effect of metronidazole. An unpleasant metallic taste is often experienced after the administration of the metronidazole, and the most common adverse effects are those associated with the gastrointestinal tract, including nausea, vomiting, epigastric distress, and abdominal cramps. Drug interactions. Metronidazole has the disulfiram-like effect when taken with the alcohol. It potentiates the anticoagulant effect of coumarin, for example warfarin, and phenytoin and phenobarbital may increase the elimination of the drug, while cimetidine decreases plasma clearance by manipulating with the hepatic cytochrome enzymes. Tinidazole, again it belongs to the class nitroimidazole derivative. It is the second generation nitroimidazole that is similar to metronidazole in spectrum of activity, absorption, adverse effects, and drug interactions. It was developed in the 1972 and was approved by the US Food and Drug Administration in the year 2004 for the treatment of Amebiasis, amebic liver abscess, and Giardiasis, but was used outside the United States for the decades prior to approval. Thank you.